Hi, my name is Dr. Erin Hunt-Carter. I'm a clinical psychologist at Great Lakes Mental Health. Perhaps you're thinking about starting therapy, or even just wondering whether it might be helpful. I'd like to share some information that answers common questions people have when they're thinking about seeing a therapist. I've found that when people have more information about the process, they tend to feel more comfortable and ready to make the decisions that are right for them. Therapy, or counseling, involves meeting with a mental health professional and working on things in your life that you'd like to change. I always tell people that therapy is for anyone who needs to solve a problem, change a behavior, gain insight, or reduce symptoms, things like stress, anxiety, or depression. Therapy can also be helpful during difficult life transitions, when you're experiencing relationship challenges, or when things just feel overwhelming. Therapy takes place in a confidential, non judgmental setting. You'll sit on a couch or in a chair like this one, no lying down like in the movies. During your first appointment, usually called the intake, your therapist will ask a lot of questions to get to know you, to understand what brings you into treatment, and to start to formulate a plan for how to help. After the intake, most people come to therapy on a regular basis, often weekly, though it depends on your needs. Sessions are usually 50 to 55 minutes. Some people benefit from short term therapy, as little as 6 or 8 weeks, whereas others choose to stay longer. There is no one size fits all timeline. Good therapy should be collaborative. You and your therapist will work together to create a treatment plan that works for you. During therapy sessions, you'll work with your therapist on the things that matter most to you. I usually start my sessions with a quick check in, and then we jointly decide how to use our time that day. At our practice, we use a cognitive behavioral approach, which means that we pay a lot of attention to how thoughts, emotions, and behaviors interact. Sometimes in session, you'll be learning specific coping skills or strategies. Sometimes we'll gently examine patterns that no longer serve you. Other times, there may be small things to practice or reflect on between sessions. A really common question people have is, what does it mean about me if I need therapy? Well, people come to therapy for all kinds of reasons. Some are navigating relationship issues, stress, or big life decisions. Other people are coping with anxiety, depression, trauma, loss, difficulty with eating. There's nothing unusual or weak about needing support. In fact, everyone benefits from help at some point in their lives. In fact, most therapists go to see a therapist themselves on occasion. I like to joke that if I never went to therapy, I would be like a dentist who believes they know so much about oral hygiene that they no longer even have to brush their teeth. Therapy is a helpful tool, and so I use it myself when I need it. I want to address one last issue that sometimes keeps people from seeking the help of a therapist. There is so much misinformation out there that suggests that people should be able to handle things on their own, just think positive, or snap out of it. I would love it if that worked. But if it did, you would have already done it. I've never heard a doctor tell someone with asthma to think positively instead of using their inhaler. We are often uncomfortable about this, but the brain is just part of the body. The brain is a complex biological system, and sometimes it requires maintenance. I strongly encourage you to think of mental health as just one aspect of physical health, no different than your dental health or cardiovascular health. It's so important that you know that seeking therapy is not a failure or a sign of weakness. On the contrary, it's a sign of self-awareness and strength. Seeking therapy is a thoughtful, proactive step toward feeling better, functioning better, and living more fully. If you're considering therapy for yourself or someone you love, I hope that you reach out and find a therapist to help. Whatever you're going through, you don't have to go through it alone. Thanks for being here.